Good morning, everyone, and welcome again to our second appointment of our webinars. Today, as you know from last time, we will start talking about myofascial treatment with our fascial tools that we have in here, and Enrico will explain you how they work and how we can use it. We have today, as well as last time, our special guest, Mr. Diego Mantovani from Paris Saint-Germain.
Hello, everybody. Hello. Good morning.
And I hope that you will enjoy, as last time, that you receive really a lot of compliments for everyone. And I hope that it was very useful for you and for your staff and for the day use of TECAR. I leave you with Enrico, that is probably much better than me explaining this kind of things. So enjoy the webinar. See you soon.
Thank you, Mauro. Diego, everything okay for you? Can you hear me?
Yeah, I can hear you. I use this moment just to say thank you to you and to all Globus friends for one more invitation. So I hope everybody enjoyed this presentation like the last time. So okay. Yes, you can start.
You're welcome, man. Thank you. All right, so we're going to start with a brief presentation. Let's have a look at the menu. Have you had the Easter menu yesterday, Diego? Everything's you enjoy the big lunch, the big Easter lunch? I can say.
It was not bad, you know. As usually in Italy, it was really not bad.
All right. Good. So let's have a look at the menu of today. So today we're going to have a brief recap of the PGE method that we already have seen last time. Just a brief recap for really understand and be sure that everyone knows the basics of the method. Then we're going to speak about the introduction of the YASM techniques. That means instrumental assisted soft tissue manipulation, and with some physiology and all the principles that are under this kind of treatment. Then we're going to speak about the functional diagnosis and a bit of clinical reasoning when we are using this kind of tools. Then we are going to do a bit of examples, some practical examples. Today is the lower limb session. Okay, so we got our model here, Damiano. And we're gonna do some practical examples, and also we are gonna combine the YASM tools with the hands-free modality. So we're gonna combine both techniques. So let's gonna start from the PGE method. We already seen last time that the power is very important for understand that we got different biological effects under the tissue. The geometry is very important for set up the right treatment, and also the electrode size and type is absolutely important. This is the therapeutic window. Just a brief recap. The therapeutic window is between the 30 degrees and the 42 degrees Celsius. We get the I can say anti-inflammatory window, right? Just the biostimulant window. With the yellow one, we are promoting the oxygenation, the vascularization, and then we got the hyperthermal window. Also, in the next webinars, we're going to have other specialists from other different countries that are going to show to us different application of the same therapeutic window. So stay connected with the Globus webinar, because I think we got a lot of news for you in the next days. So this is the power window. So the first variable. Let's go with the second one, the geometry. The geometry is as well very important thing. Last time we were speaking about the complanar geometry and the opposite geometry that give us the ability to reach the deepness of the tissues. And well, with the fascia tools, it's exactly the same. We can do a complanar one or an opposite one. I always suggest with the fascia tools to use a very short geometry, okay, not to use not to develop the current in all the body, all right, but use a quite close geometry for be sure that we are really treating the area that is our target. Okay, So the electrode size, we spoke last time, the capacity is with wet tissue, is for wet tissues, those tissues that are quite rich in water. The treatment is always superficial, we said, and depending on the size of the electrode, we can affect a biggest or a smallest area. Different thing is for the resistive. This is the resistive modality. With the resistive, we have to reason a little bit more, because depending on the size of the electrode, we can have more superficial effects or more deeper effects. Always in this case, we are going to treat it we can say dry tissues, those tissues that are poor in water, like tendons, like ligaments, like bones, like aponeurosis. And with the fascia tool, we are going to use mostly the resistive modality, because as you know, the tools are conductive. Yeah, good one. So are in metal. This is a special alloy material with a special treatment. So we are talking about resistive modality, so we can treat, depending on the surface that we are using, superficial or also deep tissues. Power geometry electrode. We did the recap. So keep in mind in a very clear way this method, because always is important to have clear in our mind. And now we're going to speak about the fascia tools. What are these things? Well, it's important to say that we can detect and treat the myofascial restriction. So these are tools that really are like could amplify our hands, are like an expansion of our hands. So we can perceive the tissue and also we can treat the tissue. The origins, well, let's say it's important to speak about the history of these tools. First of all, I want to ask to Diego if he's using these tools in his day-by-day practice.
Yes, Enrico, I'm using this, all of them, mostly the DR trigger, because my experience is the one that I can go more deep in the tissue, and I like deep treatment. So, but I use the others too. The spine maybe a little bit less. Yeah, this is the I use more than others, because with this I can put a lot of pressure when I need a good fibrolysis. Combined with TECAR, I think I feel better working with this. But of course, in the big muscle, I use the blade too, large and small, depending of where I treat in calf or hamstrings. But my fascia tools is trigger. Yes.
Which are the hole that you're using? The handle one or this one on the back?
Yes, the handle one, because I can put more pressure. Because
all right. So you need this exactly. Area to be free for using your hands combined.
Yes, and then I can go even deeper.
That's right. That's right. Okay, thank you. I would like to, as I said before, to speaking about the history, because it's very interesting to understand what is under this kind of tools. We are talking about 3,500 years ago, because we are talking about traditional Chinese medicine. So this technique is a modern evolution of the ancient techniques of the traditional Chinese medicine called guasa. Guasa means literally scrape away, scrape the fever away, scrape the bad qi away. And as you can see here in the neck, or maybe in the back part, you can see a lot of petechias, a lot of ecchymosis. I remind 1 year ago, exactly 1 year ago, with Francesco, we were in Asia, and there were a distributor there, Lai, and I hope is connected with us here. I don't know, I cannot see right now, but maybe he's connected from Malaysia. And he was talking that in his family, when someone had the flu or a headache, his mother was using to scrape with maybe some coin or a spoon, like you can see here in this picture. This is very interesting, because this has nothing to do with the musculoskeletal pathologies, but in some way this kind of techniques can promote the healing, promote the healing processes of the human body. And nowadays we don't need to do all this kind of ecchymosis, but later I will speak to you, I will try to explain to you how we can affect also the autonomic nervous system. This is very, very important thing that make us understand the possibilities of this incredible tool. All right. So for better understand, we need to have a little bit of understanding around the fascia anatomy. Fascia anatomy, well, it's something that really I love, actually. I love this picture because it seems a modern building, you know, and we can easily understand the epidermis, the dermis, and here we get the first fascial layer, the superficial fascial membrane. Then we got the deep fascial membrane, this white here. Then we got this yellow layer here, that is hyaluronic acid, and then we have the third fascial layer, that is the epimysium. Okay, so with this layer here, we permit the sliding of the tissue one to the other, in this case of the deep fascial membrane over the epimysium. And going on the deeper part, we can understand it. This is the superficial fascia. This is the deep fascia, more thick, of course. Then we got the epimysium here, and finally we got a muscle. So we got 3 layers before to reach the muscle. This is very important because these are our targets when we are using the fascia tools. Okay. Another thing to remind is that the fascia is this magical organ, is this magical tissue that gives our shape, but also is in full contact from the superficial layers really to the deepness. We can really go and find it around a single myofibril. Okay, so we get the epimysium right here, then we get the perimysium around here, then we find the endomysium, then the external lamina and the sarcolemma. So all these are part of the same connective tissue, of the same fascia. For this reason, when we treat the tissue, we can also affect in a deep way the single, I can say, muscle cell. Okay. And then I present the Italian family. This is the Italian family, Golgi, Pacini, Ruffini, and the interstitial sisters. These are the receptors that we can find inside our tissue, our fascia tissue. So fascia is a sensory organ that is really full in this kind of receptors. As you know, Golgi is more involved for the muscular activity, right? So it is the most vanished, I can say, muscular brother. Then we got the crazy brother, Pacini, that is more involved in the equilibrium, all right, skills. Then we got the most lazy brother, Ruffini. Ruffini is very lazy because we are talking about slow adapting receptors for pressure, for example. And then we got the interstitial sisters that are involved also in both in slow adapting and fast adapting for pain also, and for mechanical transversal forces. So all these receptors are very, very well represented in fascia, and these are one of the things that we are going to treat it when we are using this device. Okay, so it's absolutely important, I think, to speak a bit about of this family, the Italian family, the crazy Italian family, I can say. All right, this is, of course, a simplified cartoon model. This more in detail, the Golgi, the Pacini, the Ruffini, the interstitial receptors type 3 and type 4. If you wanted to have a check, it's easily to find them. And let's have a look on the understanding on the connection between the fascia and the central nervous system and the autonomic nervous system. For example, I want to show you this. If we get a densification of the tissue, if we find, if you get, sorry guys, I'm here. Okay. If you find, for example, a densification, that means that you got like something like a knot on tissue, all right, you can have a perception with your hands, and also with the tools you can perceive this densification of the tissue. All right, when we're gonna manipulate this tissue, we're gonna produce in a stimulation of the mechanoreceptors that we already seen just before, okay, the Italian crazy family, we can say. And what we achieve is a stimuli of the central nervous system, and we reduce the tones of the muscles. Okay, so we are going to modify the central nervous system activity through these receptors. And on the other hand, we got another way through the autonomic nervous system, and we are going to have modification of the local fluids, for example, or we are going to stimulate also the hypothalamic activities. That's one of the reasons why on the ancient Chinese medicine, they used to scrape the tissues for promoting some healing processes on human body. Okay, so we are really talking about something that now is proof. Okay, so I think I really love this kind of techniques because give us extraordinary results. And I want to ask you something to Diego, because I got a couple of questions for you, because I know that you are working with professional players. So I want to ask you this. We know that when we do this kind of techniques, especially when we put a lot of energy, we can reduce the tone of the muscles. That means we can relax, like a deep relax of the muscles. I want to ask you, when you do this kind of treatments, just before the competition, 3 days before, after, so please explain your experience, please.
Yes, as I told you, I like the deep treatment. So when we make this kind of deep treatment, especially with fascial tools, improving temperature, you cannot you created, because you wanted to create it, some under control inflammation, let's say like that. You improve blood circulation in that place. So and after that, you have to give some break to these tissues, to this area that you treat. So I don't do it just before training, for example, or the day before the game. When I want to make, I don't do. After training, for example, if training is the evening, the next day training is in the morning, next day is the evening. They have a lot of time. They have more than 24 hours to recover, so I do it. Usually it's not a problem. I avoid to do this kind of treatment the day before or even 2 days before the game. Okay. I never had some big reaction, but just in case, because during the game or hard training, this tissue has to be fresh to work. So if they are still in this inflammatory, even if under control inflammatory process, I prefer give some break or not hard training. So I don't use very deep or hard treatment the day before.
All right. Thank you. So, do you understand something about this, Diego? Is something new for you, or is something that you already know?
Yeah, of course they are refreshing my memory about physiology, but yes, I remember something about that. But it's really good that you started from this explaining, because it's always important to understand why we are doing something, no? Not just because Globus said that is good, or somebody, or I read, because you have to know why we do something always. This is my opinion. So it's always good to hear and refresh my memory about these concepts.
Yeah, it's my passion to try to go deeper in the things, you know, to really understand how it works.
Yeah, of course, always.
All right. So I got here a video for you, just for explain with an animation how the tools are working. Okay, so we got the epidermis, we got the dermis, we got the adipose tissues. Here we got the fascial layers, this white, and then we got the muscle. This is the fascial web, right? So is a web of receptors with the connective tissue all around. There is a normal movement that we need to have, a sliding, all right? over the tissue between the dermis and the muscle layers. So what we do when we get a densification, just imagine we have a densification, we can lose this kind of movement. So we don't have the sliding. Ragazzi? So giusto. Okay. So we don't have the sliding, the proper sliding. So with the YASM, you're gonna stimulate the fascia, and you're gonna promote the right communication through the receptors to the nervous system. Okay, autonomic and central. And you're gonna restore the perfect sliding purpose. Here again, densification. We are gonna treat it with the tool. Gonna reproduce the perfect connection. This is just a simplified model, okay? But just give us an idea. Si vede bene là? Perché io vedo malissimo.
Cosa si vede?
Vedo questo io. Quello che vedono loro è questo.
No, quello vedono solo questo.
Okay, this is also the fascia. I don't want to go ahead with the video. Okay. Why it goes into dysfunction? I wanna speak about the three main causes of this dysfunction. Okay, so the mechanical, the chemical, and the psychophysical things that could produce this dysfunction of the fascia. So the dysfunctions, as we already speak before, is that we don't have the perfect sliding, we don't have the hydration of the fascia, we lose the movement, we lose also the control, the pattern movement control. So the one of the causes could be mechanical. One of the causes could be mechanical. So let's give you an example. Imagine that, for example, doing my day-by-day job, I'm always bent lateral with a lateral flexion. I have an example that maybe I'm working with some drills, with some things like this for maybe for years and years. So I'm very, I have this lateral flexion for years, and this will cause for sure a mechanical modification on my tissue, for example, on fascia, or an overuse. Let's speak about some runners, for example, the runners that do hundreds of kilometers per day. They could have some overuse of the fascia because it becomes more thick, of course. So one cause could be the mechanical one, and this is straight correlated with the behavior, with the habits of the posture. Okay. On the other hand, we got the chemical things. And that could be, for example, I remember Francesco during the first webinar, he was speaking a lot about the hydration, that we need to be well hydrated. That's right, because the hydration makes the ions flow working properly. Our tissue are more conductive, and also our tissue are more healthy, we can say. So if we are not properly hydrated, also the fascia tissue could be stiff, could be not in the proper way for doing a good job. Okay. Also the nutrition. Just imagine you became drunk every night, so the acidity of the tissues could be higher. Or if you're doing, for example, a lot of training and you don't recover from the training, your tissue could be in a chemical state that is not proper for doing a good job. I can say not proper for that could provoke a myofascial dysfunction. The third phenomena is around the psychophysiological area. Imagine that, for example, there is an introvert person that stay in this kind of situation, or with some emotion, some bad emotion, could modify the postures, and for sure could modify the fascia. So we can find these nodes, this densification, also on his shoulder, on his neck, for example. The indication, well, the indication are really a lot, like limited range of motion, pain during movement, as we said before, the motor contour pattern. there are, as you can see here, a lot of indications, a lot of conditions where we can use this kind of techniques, like epicondylitis, carpal tunnel syndrome, neck pain, plantar fasciitis. Today we're gonna speak about some of them. As I told you, most around the lower limb region, anatomical region. Are there any contraindication? Yes, there are, of course, not many, but there are, like the, first of all, the compromised tissue integrity. We need to have good integrity of the tissue. If we get active implants, we cannot using just over this area, we cannot use the fascia tools. Of course, just imagine a pacemaker or some internal defibrillators or some pumps, some products, devices like that ones. Also with deep vein thrombosis and cervical carotid sinus. Be careful in the frontal area of the neck, where, as you know, we got these baroreceptors that if we overstimulate, we can reduce the blood pressure. So be careful, not only with the fascia tools, but also with manual techniques, exercise, and so on. So be careful on the anterior part for the cervical carotid sinus. Okay, so Diego, are you still there?
Yeah, I'm here.
All right. Are you having a cup of tea, a cup of coffee, or?
No, this morning just water. I'm still,
just water.
The digestion is still in process from last 2 days, so slowly today.
Today is the detox day for you, isn't it?
Detox day, yes, and tomorrow we start again.
Okay, nice. So before to going deep on the physiology, there is another theoretical part. Tell about your experience in just one application that you had, for example. Just something that you can tell about some application on your day-by-day job about this. For example, I want to ask you, do you use also the mechanical YASM, the mechanical tools, for example, not
Yes.
connected to the device?
Yes. I use a long time, already a long time. I'm using. I studied about that maybe 10 or 12 years ago and start to use. I bought this kit and I was using, and many times using after or before TECAR 2, no, in the combination. Yeah, because of course when Globus start to make this both together, it starts easier, and we could start to save time doing the treatment too. Because of course it's very good to improve temperature of these tissues before make fibrolysis, no? So usually some 10 minutes, 50 minutes, normal TECAR resistive, and then fibrolysis, and maybe after, as I used to do, now I remember, capacitive for like kind of drainage after treatment. Yeah. Now we have the possibility to do both together. So I already start, as I said last time, it's always a question of time. We usually don't have a lot of time with player before training, no, because they arrive all together and you have to treat, you put them to make a warming up and gym and go to the pitch. So it's good to save time. So usually I do TECAR with fascia tools, and sometimes I finish in any case in 5 minutes only normal TECAR capacity for this drainage, and the player is ready. Of course, I'm not talking about the case that has some injury. In this case, we have time to take him, different time, not together with the team, and you have a lot of hours in one day to treat as you want. So yeah, this the way I used to work with fascia tools.
So it's a long time that you're using the YASM tools. You tell me, I understood 10, 12 years could be?
Yes. I started this in Monza. It's a city close to Milan. I think like 12 years ago.
So you have a huge experience in this. Okay, thank you.
Yes.
Okay,
welcome.
Let's go more deep in the just few things around the physiology and the benefits also that we can achieve from this kind of technique. The first one is a cellular level. By using the tools, we are going to promoting, as we said before, and also the webinar before, the fibroblast production, the fibroblast stimuli, so we can achieve elastin, hyaluronic acid, growth factor, all those substances that are very important for the healing of the tendon. Here we got an uninjured MCL. In this case, is a rat ACL. This is the untreated MCL, and this is the treated MCL. As you can see, we can organize the, we can say that the fiber, the healing process of the tendon, that is quite similar, becomes very similar to the uninjured MCL. So remember the cellular level. We can stimulate the cellular processes, the cellular recovery processes. The other interaction that we already spoke before is the interaction with the mechanoreceptors. We already speak about Golgi, Ruffini, Pacini, the interstitial receptors. These give us the ability to change the muscle tone and the fascial stiffness, and also the fascial densification. A question for Diego: do you use maybe the roller for the massage of the players? Are they using?
Yes.
You know, the
yes.
black roll.
Yes. Maybe all of them use. A lot of players have, even at home they have. But in Paris we have a gym, a place just to make some stretching, mobilization, and the roller. So they use it. It feels comfortable, feels good. So. And it's something easy to use because they can do by themselves, you know.
Exactly. So the understanding also of the release with the black roll is quite similar to this, because we are not just treating the fascia, just not treating the mechanical one, but also we are involved with all the receptors. Okay, so we are gonna to increase the vagal activity and reduce the sympathetic tone. So good idea, I think, to use also the black roll. But here we got something more. Here we got also the benefits by connecting the one special device to the tools. And what we can achieve is the warming of the tissue. And this study here show us that if we increase over the 50 degrees Celsius, we can break down the hyaluronic acid chain, so we can increase the sliding between tissues. But not only this, we can also promote the regeneration of the tissue, the oxygenation, and the drainage, of course. So the benefits are double, I can say, okay? And then there are the benefits to the therapist. For us, this is very important, I think, because years ago, I was suffering of a pain thumb, a lot of. Every evening, I was going on with a lot of pain on my thumb, and actually there is a lot of evidence for the pain-related pathologies. I mean, the pain that we can perceive during our day-by-day job. In this study here, there are a lot of. But in this study here, I want to show you that 85.7% of this group of study of these physios, in this case, have altered the manual techniques because of the thumb pain. So they need to change the way to treat the patient. And the 27.7 had a high prevalence of osteoarthritis. And we are talking about young people, like 38.6 year mean age. So they were developing osteoarthritis of the thumb. Another thing important is speaking about the carpometacarpal joint laxity, right? And the decreased pinch strength. So we lose the ability to have the pinch, to have strength in our hands. And also there were a losing of the muscles of the hand. So it's very important to save our hands, and these tools give us the ability to reduce the pressure that we do every day. For example, I suggest this by using, for example, this tool here. Just by using 200 grams, we develop 1 kilo force. That means 5 times more. So we save 5 times our effort, I can say, our force. so our joints can be more safe, right? This is a very important thing because there are a lot of other studies that are speaking that, well, physios need to change his job, need to change the techniques of work. For example, in here, the PA mobilization, that means the posterior to anterior mobilization that we can use with this tool here, that usually we do for Maitland techniques, for example, are one of the most dangerous for our hands, or the soft tissue massage, or the Mulligan mobilization, or imagine the trigger point pressure, like the ischemic pressure maintained for minutes and then for hours, can really damage our hands. So having some tools is really a good idea for save our hands. Diego, do you agree with this, or have you ever suffered about pain to your hands?
Yeah, absolutely agree, because as I said a few times already, as I like to work hard and deep with hands, because I really believe in manual therapy, this is sometimes can be a problem. You know, we use different, we change ways how to work. We start to use elbows, sometimes knees, as I do too, but of course we don't have the same sensibility. When we work with elbows, we don't have the good sensibility. You have to touch, palpation, and find the place, and then put the pressure. In this case, you can do it together with hands and with the tools. It's much easier to do that. It's really something good. You know, we are still young, so we don't have a lot of arthrosis problems. But in the future, I'm sure, I'm sure the fascia tools will save our joints, our tendons. Will have to be to keep you working till still a lot of time.
All right. Mauro and Pierpaolo, are there any questions from home? I see a lot of people here following us, really a lot of people. I say Malvina here, Ali. Ciao to everyone. Are there any questions?
Not yet. I think they are very attentive to your explanation, and they will have probably some question after.
Okay.
After it.
Well, let's tell me that last time they were following from 80 places all over the world, 80 countries. So 80 is really a lot. So really, thank you for follow us. I hope we can share with you our passion, our day-by-day job. We are here just for have a discussion. Also, on the next webinar, we're gonna have 2 more physios from other different countries, so it will be a surprise, I think. And so let's go ahead with this, so we can enjoy also the practical part. Before to do the practical part, we need to manage something about the functional diagnosis and the clinical reasoning. This is a very important topic that we need to understand, because when we are using this kind of tools, we call them blade, all right? So it's not that you get to cut the patient, of course. You need to understand how to use it. For this, I think it's very important to understand also some basic principles around the functional diagnosis and the clinical reasoning. All right, first of all, the first question that we have to make to ourselves is this a structural or a functional problem? Well, if we are talking about a structural problem, it could be a problem of traumatology, post-surgery patient, or maybe we are it's very easy to find some positive imaging of the damage, because it's very easy to find when we are talking about structural problem. Also, we can have an acute inflammation. About this point, when we are talking about functional, it's not so easy to find an imaging of the damage. We get the pain, the patient is suffering, but it's not having, we don't have a clear imaging, maybe an RNM, an X-ray, or an echography situation. But with the structural one, we can easily identify the site of the lesion. And in this case, the technique needs to be upstream or downstream of the lesion. That it means up on the proximal part or in the distal part, but not in the site of the lesion. Okay, very important to understand. So, for example, if we got a lesion of the Achilles tendon, for example, I don't do the treatment with the YAS directly on the tendon, but maybe I can treat the quadriceps, I can treat the ischiotibialis, I can treat the tensor fascia lata, all that surround the area, but not the lesion, okay? If we're speaking about functional problem, so maybe there is a movement dysfunction. The pattern of the movement is not proper, is not correct. So maybe we get also bad habits, like I'm talking about style of life, maybe not good hydrated tissue, not proper recover after the sports, for example. Maybe we got a chronic pathology. We have to exclude, of course, the red flags. So we have to be sure we don't have red flags. But if the problem is in the myofascial syndromes area, we can treat also in the site of pain. That means we can treat proximally, distally, all right, but also directly on the site of the lesion. This is a very important and easy also functional criteria. Also, we got the mixed pathologies, both structural and functional. And I suggest to you to use this kind of approach, not directly, all right, on the lesion, but upstream and downstream. Okay, let's go to talk about the piriformis syndrome, the first topic of today. So I'm going to introduce Damiano. Is our friend Damiano. Please come here. Thank you for coming. Poi stenete pancia in su. Pancia in su. Okay. So if we're talking about piriformis syndrome, nowadays actually is called in a different way. It's not so popular and it's not so stylish, I can say, because we are talking about deep gluteus muscle syndrome, because sometimes not only the piriformis is involved in this pathology. A brief evaluation, right? The mobility of the hip, for example, here we get a limitation on the internal rotation of the left side. Here's a bit better. Okay, we could have the Lazare positive because we have we could have the compression of the ischiatic nerve, right? The patient sometimes has problem when he stay in a long sitting for a long time, and I want to show you something. I got a surprise for you. Maybe we can enjoy together. Oh, here. We got also a model here. What do you mean? This is a 3D anatomic atlas. Okay. I want to show you something because when we're going to treat, we're going to have a very clear idea of the anatomic parts of the anatomic area. So sorry for the ladies, but I'm going to undress this beautiful lady here. All right, here we go with the muscles. I do a zoom. So we are speaking about the piriformis area. So we have to keep in mind the gluteus maximus here, the gluteus medius, and if we remove these layers here, we can reach the deepness, the deep muscles, and here we go with the piriformis muscle. Okay. So when we are talking about the piriformis, sometimes there is something wrong because actually sometimes the problem could be on the quadratus of femur, like this, or it could be on other muscle, like the gluteus minimum, for example. We have to be sure that we are really the problem is in this area, or if there are other muscle that we need to think about. Okay, a good way, for example, if you're going to speak about the piriformis, is to elevate to 60 degrees. That we know is the crossover points for the piriformis, and having a medial adduction. If we had a limitation, for example, of the movement, we are sure that we are talking about the piriformis shortening. Okay. In this case, for Damiano, this is very good. We have a very good medial translation. But in this case, if I fix the pelvis, I cannot go on the medial part because on the right side, fortunately, we got exactly a piriformis shortening. Okay. So face down. Puoi togliere la maglietta. Sì. we're gonna use this device here. So we need to put a bit of cream, as you know. We put the plate under the belly. Then we need a cushion. C'era un cuscino rotondo qua dietro. Ok. Alza I piedi, vediamo. Ok, giù. So the first part for starting the treatment could be capacitive, as maybe you can see on the online courses. On the online courses section, you can find also this kind of treatment. So it's very easy for you to go on the www.tecarglobus.com. Inside there is the video section and the academy section. You can find all the videos. I show you briefly how we can start a treatment, for example. Questa qua. This is a live session, guys, so let me organize. What we need to do is, first of all, to change the cable. We need to put the cable for the fascia tools. That is the same that we use for the hands-free treatment, okay? So the blue one, that is resistive, as you know. We said that here should be a restriction of the piriformis. Yes, and I easily can have a good idea. Yes, we have the perfect case. So we can start, for example, with a capacitive phase. With a capacitive phase, the aim of this phase, I don't want to spend so much time to do the complete treatment, but the aim of this phase is to warm up the tissue. Okay, so with the capacitive, we're gonna warm up the tissue to prepare. Okay, I can do just a few seconds of treatment. Capacitive is very easy. I want to reach the 35 to 38 window. Okay. I can also start with a relax in here. 0,10 Damiano? 5. Okay, I set up a 62% of power. The current is around 300 milliamperes. Damiano is perceiving a 5 to 10 temperature scale, I can say perception of the worm, and just gonna relax. And okay, now we reach the 7, so I can reduce. I can also use my hands and also a thermometer, like we said last time, for be sure that we are on the right therapeutic window. Using the edge of the capacitive, also I have the idea of what I'm doing under the tissues. For example, the sacral area, where we get the piriformis insertion and also the gluteus maximum insertion, it now is very stiff with some bundles, some stiff bundles here, okay? So after just few minutes, when we start to see the sweating of the tissue, we can change with the resistive, with the fascia, okay, program. We just need to go, we can go inside the fascia program. Oh. I can choose, for example, the DIA trigger. Okay, I suggest to use also the gloves. Okay, so the gloves are indicated for having a good isolation with the tool. All right, here we are, guys. So, Damiano, avvisami.
Sono
Okay, we instantly reach the 4 to 10. Diego, are you there?
Yes, I'm here, of course.
Okay. Do you use the same plate positioning? Are you using the same way of treating, in this case, the muscle, or what you're gonna to do in your day-by-day practice?
Yes, especially for piriformis, this is a good way, in my opinion, but I like to in the lateral bend.
Yeah.
For example, if you like treating the right side, he could lay on the left side, bend a little bit the hips and knees, and in this position, you can go more deep, especially in the distal part of the piriformis. I mean, in the insertion of the femoris insertion of the piriformis, close the tendon. Usually we have some trigger points in that position, so I do both. I start in this position, and then when I have some anesthetic reaction, I mean, he's getting using of the treatment. I make lateral bend and go deeper.
All right, it's a good idea. It's a good idea. With this patient here, with Damiano, we, for example, in this case, the proximal part is more involved, so I decided to shorten the muscle with the bend position, abduction, and external rotation of the leg. So in this way, the muscles are in a shortened position, and I can reach the deepness and go also under, a little bit under the sacrum. I can use also the Dia blade small, the other one that I really use a lot when I want to do some specific work on the fibers, on the insertion of fibers. In this way, I suggest you to use a very flat position at the early stages when we start to use it. Otherwise, it's so aggressive. When we use in a orthogonal position, the surfacing contact is very small, so the energy is very high. So we need to stay in a very flat position at the beginning, using this 30 degrees edge here, as you can see. Okay, and in this way we are very safe to perceiving the tissue, to relax the tissue, especially the bands that are very, very, very stiff, and also is gentle for the patient. He described me a 6 between 0 and 10, so I think is a good way. Also, you can see here that maybe you cannot, but we are starting to promote a vascularization of the tissue, of course. With this technique, we don't need to have some ecchymosis, like you said on the ancient technique. Okay, we don't need to do a lot of mechanical movement. I will explain something. When you use just the tools, you need to scrape a lot, really a lot, for increase the temperature level. Because as we said before, we need to reach the 38-40 degrees for having this hyaluronic acid relaxation. Okay, so you don't need to do all this manual therapy, because when you connect the tool with the device helps us to doing the same thing. Okay, to increase the temperature on the hyaluronic acid layers. Does it pain? Fatica male? No. Okay, no pain for Damiano, and I'm using a quite good energy. I'm using 40 watts, okay, on the fascia tool program. There is a special program, of course, on the machine for be very specific, okay. It's a program that has at maximum 50 watts of power. Okay, this could be an easy way to start, for example. Of course, you can combine with manual techniques, and also, for example, the Dia trigger that we said before, this one that Diego likes a lot.
Yeah, let me tell you that in this case, for piriformis treatment, if you want to use only hands, it's really painful for a physiotherapist.
Yeah.
because it's some deep in this special case for him. He has a good gluteus maximus, so you have to go through the gluteus maximus to arrive to reach the piriformis. So it's not you cannot go superficial. So you have to go really deep. This kind of treatment that we finish, and you have some hands pain for sure.
Exactly.
There is a question, Enrico, about petechias that you told us before. One of the participants asked, with the fascia tool, is normal that petechias appear. Women in particular do not like to have marks on their skin.
Right.
How to avoid petechias?
Yeah, we need to do the proper treatment with a good level of warming of the tissue. So the vascularization part, the capacitive part, is absolutely important for having a homogeneous vascularization of the tissue. Then, when the tissue starts to sweat, when we reach the specific window and we stay on the window for several minutes, we can start with the tools, but with not so much energy. Also, the techniques is very important. As I said before, we don't need to go straight in the orthogonal part and doing a lot of, I can say, force on the tissue, but very gentle manipulation. As I told you before, if you push 200 grams, you achieve 1 kilo force. So we don't need to use a lot of power, I can say, a lot of force. I suggest to have gentle technique, and no petechia will appear. Okay, so depending on the force that we put and depending on the target and the objective, sometimes the petechia are a good sign because we have a disgregation. I can say we have we solve the knots that connect the epidermis with the first layers of fascia. So we are going to promote the right sliding on tissues. Okay. Other questions, Mauro?
Yeah, same person asked if for fat reduction you would suggest to use fascia tools.
Well, for fat reduction, this is the beauty, I can say, field. I'm not an expert in that field. On the next seminars, we will have some experts speaking about that. So I suggest you to follow us. Well, the resistive method is a good option for the fat reduction. I know that some clients are using this kind of tool, this kind of, I can say, of technology. Could be, I think, a good idea for cellulitis, for going where there is a stasis of the lymph nodes, of the adipocytes also. So, but I suggest you to follow with the specialist for that area that will come in soon in the next days.
Thank you, Enrico.
You're welcome. Okay, have a brief check. We just read a couple of minutes, but I want to retest. Damiano, please face up, faccia verso l'alto. Ah sì, se la tolgo. Well, we achieved 15 degrees more of, maybe you cannot say here because we need this kind of view, but well, we increase the internal rotation and have a look. Wow. Now if we fix the hip 60 degrees, lo senti che è diverso?
No.
All right, now we're crossing the other leg, so maybe we need to do a bit more on the other one now. Oh, are similar. It's okay, are similar. Okay, Diego, any questions, any ideas? What do you suggest?
No, this is, I think you have already very good results with this treatment. So it's, it's really true that the piriformis is a good muscle to treat in this way, because this muscle gives us the good satisfaction. No? When you make the treatment, you go deep, you improve temperature, you have this decrease of tension, and you test just after 10 minutes, you see already the difference. So of course, this is a good way to treat. And as you told before, when you find that you need to treat more sacrus part of the piriformis, I think this position, laying on the front, is the best way. When you have to treat more tendons or close the tendon or femoral part, you lay on the lateral side, and you can go with a small bend of the hip and the knees. You can go deeper. It's a good way. And why not make both?
Exactly, exactly. So let's do what you suggest to do. Where do you use to put the blade usually? In the lateral?
Yeah, usually I put a towel between legs and the plate in the left leg, under the left leg, between legs.
Okay, perfect, perfect. It's what I used to do. Great. Yeah, this is a good way to put the plate. Yes, we can put or under here. No, or under here. Yeah. But if our focus is this part of the hip, yes, I suggest to put under the hips. Always we need to.
I prefer because this way is closer.
Yeah, this way is closer. Be careful that we need to have the very good surface in touch. The contact of the plate has to be absolutely perfect. Okay, with the biggest area as possible in contact with the patient. And in this case, we have the double contact. The up part and the lower part are in contact, so we have the full guarantee that that the plate is in good contact. By the way, here we get all.
Usually, I put like a towel under the plate, you know, to improve the surface touching, in this case, the left leg.
You're right, and also this plate here is flexible, so sometimes we can also bend with a elastic band around the hip, around the leg in this case. Okay, so
in this position.
Yeah.
This position with the trigger, I go directly. I find the insertion of the piriformis, and of course I'm in this position. Already I treated the other muscles too, external rotations of the femur. So as you showed before.
Yeah. I wanna share to you something to know what you think about. Sometimes the typical exercise that the trainers at the gym suggest for relax the piriformis is like this, no? This kind of stretching, doing to a wall. But actually, this exercise is for the quadratus of femur. You're not affected the piriformis because in this position, actually, the piriformis is not so stretched. So this is not a good exercise.
Bend more the hip.
Exactly. Or doing what we were talking just before, reaching the 60-degree position and go on the medial.
Abduction. Yes.
Nice to share this information together. Okay.
So and of course, sometimes it's difficult to know if which exactly muscle. No, when you're speaking about a small muscle, very often they have. In a football player, it's very powerful. The gluteus, grande gluteus, is external rotator. So it happens that very often they lose the internal rotation, and to improve the internal rotation, it's a very good result, and we decrease the tension in all rotator muscles, hip, these small, short, and deep muscles. So in this case, it's very good the DIA trigger too, and manual mobilization, manual treatment. But before manual treatment, as I used to do, I go deep with the DIA trigger, decrease the tension, improve the blood circulation, and then I can make my manipulation, mobilization, stretching, or all technique that we can do.
You're right. Great.
There is a question, Enrico, about how many sessions of treatment of that fascia tool we have to do for have a good result.
Can you answer?
Depends. Now he had already a good result in 10 minutes treatment. Of course, in this case, probably he will need to repeat in the next day or in 2 days. But it depends of the case, you have immediately good results.
Yeah,
In
it's
some
very good,
cases,
because the next question is how many days of recovery between one session and the other?
yeah, the answer again is depends. Depends the feeling. Usually, when I see the patient next day, I ask, how was your feelings, your sensations? You wake up with some new pain, can be some reaction after treatment. If you say no, it's nothing new, maybe I feel the same or I feel a little bit better, so I do again, and the next day one more treatment. If I create some, as I said before, some inflammation around the area, inflammation that I wanted to create, to improve blood circulation, oxygenation of tissue, I wait 1 day more or 2 day more, 2 day more. But of course, every time we see, not only this case, but our patient, we have to make a continuous evaluation. You cannot make evaluation the first day of treatment and make all treatment. Every day when you see, again, evaluation and decide which technique, how to treat, what you're gonna use, heat treatment, not heat treatment, 1 day pause, stop, or depends of the reaction of the after the treatment. It's possible to do the day after. It's possible to do each 2 days, each 3 days, or once a week. Sometimes is enough to do. Depends. If you, in my opinion, if you treat myofascia, like for example fasciitis plantaris, chronic fasciitis plantaris, is once a week can be enough.
Mm-hmm. Yeah. Good answer. Thank you. So I want to go ahead with this lateral position that could be fine for iliotibial band syndrome. I want to just have a brief recap on the anatomy. Let's have a look here. What are we talking about? This is the iliotibial band syndrome. The iliotibial band anatomy, we can say, all this white and connective tissue, band tissue. This is the belly, just the muscle, the iliotibial tensor fascia lata. Okay, so we are treating all these this fascia here. The pain is usually very close to the knee. Is also called runner knee syndrome. Okay, because we have the pain on this area. The cause could be, well, the food could be the hip, the management of the trunk, an overload. The cause could be really a lot of things that needs to be evaluated, as Diego said just before. Just have a keep reasoning around this, that, well, these kind of muscles are one in contrast to the other. So under we got the vasta lateralis, and we got also the lateral part like the gluteus minimum. So over this, under this muscle, we got other muscles that maybe need to be treated as well. Okay, so also be we need to have a very clear imaging of the tissue that we are treating at. Okay, so this could be the good position, I think, for the fascia lata. The basic test could be the over test, or evaluate the adduction of the hip. Okay, lascia pure, no, appoggia pure a me, lascia pure, no, lascia rilassato. Okay, yes, in this case we have it actually. So we cannot reach the bed. Okay, it's going down, but not so much. The extension is good. Okay, so maybe we need to treat the tensor fascia lata here, the gluteus minimum, as I told you just before. Well, the positioning could be the same. We can put the plate under here or under the belly here. Depending if we get the shape of the body that is with a hole, I recommend to put, like also Diego said, just here in the middle. Okay, let's have an example. So we put the plate here in the middle. Okay, appoggia pure. Okay, giù. Then I use a bit of paper. Yeah, all lateral part here, tensor fascia lata, and small gluteus here is very stiff. I haven't checked the quadratus lumbaris and other things. Okay, this is just an example, guys. So, but for these bundles here, I can use also the dia blade large. As we said before, we need to prepare the tissue with a capacitive mode, and then we can start with the dia blade large, this one, okay? So, few seconds with the capacitive. Are you using, Diego, also you the capacitive before the treatment with the fascia tools?
Yes, sometimes I use this just to prepare to increase the temperature for treatment.
Yeah, that's right. For example, I get a sensation under my hands here that because of this tissue are very, very stiff and very poor in water, maybe the capacitive could not be the right treatment for this area here. What I could do, I could go straight with the fascia, but with a modification of the technique. Let me show you. Ooh, sorry. I did an issue here, guys. Sorry. Are you relaxed, Adriano?
Yes.
Okay. So, I select the fascia modality. Okay. I stay here with a flat, just a flat positioning. Okay. So, I stay fixed here. I asked to Damiano if he perceived some warming sensation, like having a normal resistive tool. Okay. So without having any scrape technique, just waiting for a warming on this area, on this anatomy region. 0,10 quanto sempre?
6.
Okay, he's starting to perceive a 6. Okay, so I'm not using the capacitive for preparing the tissue. I'm just using straight the fascia tools, but without using the edge, just the flat area. Okay. Until he reached the 7, for example. Quando sei a 7, mi dice.
Okay.
Here we are?
Yes.
Okay. Yeah, we had a very gentle sensation of warming. So I reduce the power and I can start with the edge, with the 30 degrees edge at the beginning. I'm not going to strength with this kind of profile, but I'm starting with the 30 degrees edge. Okay. In the next section, we can also use the other edges of the tool, like this area here. Or later, we will see how we can use also this part here. But for treating, in this case, the gluteus minimus and the tensor fascia lata, this is a very good option. I can feel also a noise under here. There is a noise of the densification of the fascia that we are going to loosening. We are going to solve. 0,10 quanto caldo sente?
6.
We are always around a 6, 7 in terms of perception of temperature. Can I ask you guys the thermometer, please?
Enrico, there is a very few very interesting questions about, for example, the one is about the optimum duration of warming up the tissue before Yastman.
Yeah.
In your opinion, which one is the optimum duration? 5, 10 minutes?
Yeah, as Diego said before, we need to perceive the tissues. Are the tissues that are telling us the right duration? Could be 3 minutes, could be 10 minutes, depends on the patient. If he's well hydrated, if we are talking about a chronic pathology or a fresh pathology. So a good thing is to see the start of swelling on the surface, when we start to see this swelling on the surface of the patient, we know that we are starting to promote the thermoregulation. So we reach the right point, and maybe we need to stay there if we want to relax all the muscles around the area. And if we are sure that all the muscles that we want to treat are I can say vascularized in a homogeneous way. Okay, so we don't need to warm up just the skin, we need to warm up the tissue that we want to target on. Okay, this is very important.
And there is another question. If we are not an expert as Enrico on the use of fascia tools, there are some protocols on the machine that help me to perform the right treatment, or do you have some videos or some other tools that can help us with different pathologies?
Yes, we got the video session on the website, where different pathologies for myofascial pain treatment syndromes. So it's easy, it's very easy to understand. You can just have a look one time and you became an expert too. So it's nothing complicated. You just need to practice a bit, and it's very easy. So,
but there are no protocols on the machine.
No protocols on the machine for the fascia. There are all the protocols for the typical traditional, I can say, classical pathologies. Okay, the basic principles are almost the same. Actually, we need to become more confident with the use of the tools, with the use of the techniques, and combine it with the device. But it's nothing really complicated. Okay, so have a look on the tecarglobus.com on the video section. You will find different pathologies examples, and when you understand the principle, then you can easily apply in whatever pathology that you want. Okay.
And let me tell you that it's question of manuality, and we use maybe the first time you don't know how to hold, you are some doubts, but when you try 1, 2, third time, fourth treatment, you are already confident with the tools. So it's absolutely automatic.
Yeah. Spingi in alto la gamba e rilascia, spingi in alto, rilascia, spingi in alto, ok, rilascia, ok, lascia cadere adesso. All right, so in a few seconds, I try to solve the problem here. Actually, we need to treat also the lumbar part, and we need to go down the fascia lata. Just have a look how to treat the fascia lata with another edge of the tool. So I'm going back to this position. Mettiamo qui la piastra. Alza un attimo. Giù, porgia qua. Porgia. Ah, giù riversa adesso. Vale pure qua, tranquillo. Okay. So we are speaking about using the curved edge. Maybe here you can have a look better. Okay. Here, this is the perfect way for treat, because what's the difference between the linear edge and the curved edge? Here, the pressure will be homogeneous for a rounded surface. Okay. In this case, if we connect the tool in this rounded surface, the pressure for each millimeter square is higher. So in this way, regarding also the question of reducing the petechia, reducing the damage on tissue, we can easily use this edge for be sure that is a very gentle and homogeneous treatment on the skin and on the fascia lata. So I put a bit of cream. We are also in the resistive mode. So I can start to, I can also put the cream all over the leg.
Graston technique and YAST are the same?
Yes. There are a lot of names, a lot of different, depending on the, I can say on the model, on the factory, of course, the technique is absolutely the same.
Okay, thank you.
You're welcome. So I'm starting to just scan of the tissue. I need a bit of more cream because this is a very big area, very big muscle. So the machine helps me to understand if I'm closing the circuit or no. I always have to stay in contact with the patient. I don't have to do this, all right? Because otherwise I will close the contact and open the contact, close the circuit and open the circuit. And I want to warm the tissue in a deeper way, in a continuous way. So I want to maintain the contact always. During the first movement, I perceive the dosification. For example, over here on the vasta lateralis, there is a stiff point between the vasta lateralis and the fascia lata. So it's like using my hands exactly, but in a more specific way with no force, no effort.
No.
Okay. No pain for him. And after a few seconds, I can use the other edge over here to be more direct on the densification point. You're a cyclist, isn't it? Same ciclista, you know? Sure. Okay, he's a cyclist, so this band here is well represented, I can say. Okay, so sometimes also cyclists are suffering from iliotibial band syndrome. Okay, so a pain on the lateral part of the condyle, and we have to manage the whole chain. Okay, the whole muscle chain, not just the side of the pain, of course. In this area, later we will see how to put the hands-free method for manage without using our hands, without also using our time, for manage the pain for the patient. Okay, I don't spend so much time just for have a quick show to you, okay? But gonna retest just a bit the limb. Okay, stai pure rilassato, completamente morbido. Oh wow! Now we touch the bed. So okay, just one more example. Diego, what do you suggest for using the hands-free? Do we have an idea where to put the place if we want to use the hands-free method? Can you hear me, Diego?
Yeah, I'm here.
Okay.
But I lose the video. I just and in this treatment that you can you hear?
I can't hear you. I can hear you. So let's do this. I do the first example. For example, this in the case of the fascia lata treatment, and maybe you later you can suggest us other different options. So I suggest one, just to put one band here. Okay, and the other one that I got over here.
I use the DIA trigger, but it's similar.
Ah, okay. Yes, I was suggesting you just using the hands-free. You can have both the adhesive, okay, or you can have the metal one. This is the new model, the flexible that you can reuse 1,000 times. In this case, I have to choose if I want to do a pain reduction, just a promotion of healing on the lateral part of the condyle, okay, or if I want to do a treatment on the side of the stiffness. Okay, let's do this example just on the side, just for reducing the pain. I can easily connect the two with two bands, the two plates. So these are the two plates, as you can see. We are promoting a superficial energy flow through the lateral condyle and the lateral part of the fascia lata. We just need to connect it with the two cables, the black and the blue one. Is the same that we use with the fascia tool. So very easy, just two cables to connect, the blue and the black one. This is an option. Okay, this could be a short geometry on the hands-free. We spoke last time how to use the hands-free. Also, you can find on the site, on the internet site. Short geometry. We can set up 20 to 30 watts for treating just this area, or we can use a large geometry or medium or large geometry. Maybe we can put the band on this part here, okay, and putting the blade straight on the lateral part, for example, on the fascia lata, on the gluteus minimum, for have the all energy through the iliotibial band. Diego, any questions or any other ideas, for example?
He has a bad connection.
Ah, right. Any problems with the Diego connection? Any questions, Mauro?
Not right now. I would like to ask to every participant, if you have questions about what you see right till now, please give us your questions on the chat, and we'll answer you directly. So you are free to do it right now.
Yeah, I'm going ahead with some other examples, pathology examples. Ok, vieni avanti in su. All right, let's go talk about other things like chronic tendinopathies, for example. On the lower limb, the very common chronic tendinopathies could affect the patellar tendon or the rectus femoris tendon, for example. As I told you before, during the evolution, if we got an acute injury, don't do the treatment with the fascia tool directly over the tendon. Okay, we can do it proximally, or maybe on the back part, or on the glutes. All that can improve the healing of the distal part, can recover also, increase the recovery processes. Now I'm going to show you just an example where to put the blade, which is the right foot tool. Okay, like if I want to do the quadricep, I can put the blade under the thigh. I suggest to use with this kind of shape the dia blade, the big dia blade, large, dia blade large. Okay. After the preparation phase, we can go ahead with the resistive, just for show you some manuality over here. Okay.
This is a question about hands-free using.
Yeah.
For osteitis pubis.
Osteitis pubis.
Osteitis pubis.
Yeah. Do we have the connection with Diego, or we lose him?
Let me check.
Because I would like to that him who speak about the groin pain area, because the groin pain is very common for football players. I would like that you can.
Yeah, Diego is back again.
Okay, hi Diego, can you hear me now?
Yeah.
Okay.
Yeah, I can hear. I don't know why I cannot see you, but I can hear.
You cannot see.
No, I have some connection problem probably.
Okay, it doesn't matter. Just a question for you. How can you manage the groin pain on your athletes? Can you share your experience about the groin pain and all the rectus and pubis, rectus pubis and rectus adductor syndromes?
Yes. No, now I can see you. Okay. I think it's better now, connection, for some strange reason. Yeah, groin pain. As I understand, there was a question about the possibility to use this in groin pain. my answer is yes, of course, but depends of the cause of growing pain, because when you speak about growing pain pubalgia, we have several different causes. So as I spoke before, evaluation, when we understand from when this problem, this growing pain or this pubalgia starts, and then we can decide which technique you're going to use.
Right.
For example, if you understand that the problem starts from adductors muscles, we know that good treatment could be decrease the tension in the adductors. So we can do TECAR, manual technique, fibrolysis, using fascial tools to decrease the tension in the adductor. The same for rectus abdominis or iliopsoas. Several times, tendinitis of iliopsoas can be treated with a resistive TECAR too, because we're speaking about some deep structure. So my answer is, you know, speaking about the growing pain, we need a lot of time to that we can discuss about that. The first of all is understand from where, what is creating this this pain, and then we can make a treatment plan.
Exactly. Exactly. Yeah. How you manage generally? For example, think about your last case of growing pain. What do you used to use? What you use in that case? I can say.
Yeah, my last case was a guy that had a lot of pain in the low part of the belly. Was a big stiffness in the iliopsoas, and had absolutely not pain adductor. So we treat few treatments, rectus abdominis, iliopsoas, manual treatment, decrease tension of all hip muscle, gluteus, TECAR in the pubic symphysis, manual treatment everywhere, and not good results. And then I decided to make a more global evaluation and found a lot of densification in the longus adductor. But the adductor was not painful. He could make a good contraction adductor, not pain. He could run. The pain was never in the adductor. But I don't know what else I could do for him, so I decided to focus my treatment in the adductor. And I tell you, after 2-3 days, he was much better. So in this case, the cause of his pain was not the place that he was feeling the pain, but was in the adductors. So I use manual treatment, I use fascia tools, I use the dia blade as you are doing now, and I focus in the densification in the trigger points with the dia trigger. Was really painful treatment, really painful, but the result was unbelievable in just few treatments after a long time without a good results.
All right, thank you for sharing your experience, Diego. Thank you, really. I want to show you something right now.
Yeah, welcome.
Okay, this was the example of the chronic tendonitis, no, not chronic, sorry, acute tendonitis of the patellar tendon. As you have seen, I haven't treated the tendon right now. Maybe we can do with just a normal resistive way, the small rounded electrode like we did last time, okay? But for helping the tendon, I treat the old quadriceps, in this case the vasta lateralis, with the intersection with the fascia lata. There was a lot of stiffness here, so we solve all the muscle contraction here. And by the way, I did also some manual mobilization of the patella, also with the tools, as maybe you have seen with the Diaz ball or Dia blade small, that help us also for mobilize the patella. And on the next webinar, we will see also on the shoulder how to use the tools for mobilize and not only for treat the tissue. This is another way of using the tools. So in this case, if you want, we already did last time actually, But if you want to use the automatic treatment on the I can say on the patellar tendon, imagine that we have several possibilities. We can use, for example, the plates here. Okay. Imagine that we can put a couple of plates, one here and one here, band with an elastic band, and we can promote a warming of the whole knee. But if we want to do something more superficial, we can put the plates without the plate, the big plate here. We can put just the plate, the small plates, one here and two down here, and we have the electromagnetic field just on the superficial layers. So always keep in mind the geometry, the opposite geometry, okay, between up and down, or the complanar geometry. That's an attimo, where we have this kind of application. This is just an example, but just for make you reasoning that is very important how you put the plate, and also the frequency can help you for select the superficial layers or the deeper layers. Okay. Any questions or doubts around what we said before?
Yeah, there are some questions. For example, hip impingement syndrome.
Wow, nice, good question.
What about?
Wow, there is a they talking here.
This is Nancy from Lebanon.
Hi, Nancy. Nice to hear you. Well, we can speak really a lot about the could be the FI, you know, the femoral acetabular impingement, the CAM, all the different types of femoral acetabular impingement, and well, really we can do all the things. I suggest you just some easy positioning, something that we can show in a few seconds. Let me just. Allora, faccio la sua. Portami sedere un po' in fuori. Okay. Sometimes what we need to evaluate is also the extension, for example, of the hip. We need to reach a good extension, and sometimes there is the iliopsoas or other muscles that limitate this kind of movement. This is not the case, of course, but one of the aim is to increasing the temperature here, solve the problems on the anterior chain. I can show you something with the atlas, because we got this very nice opportunity to show you something here, where, for example, we can reduce the muscles. Okay. I can also take away the intestine, for example, for show you the iliopsoas muscle. Here we are. So here we are. This is the iliopsoas muscle. As you can see, it's a very big muscle that, as you know very well, from the lumbar spine, reach the iliac crest and can reach the small tuberosity on the femur. So this is our goal, to reach this muscle here. Or, for example, the let me take this. All right, the iliacus muscles also. These are often very involved. They could be tight, or it could be not so strength enough, or maybe shorter. Sometimes also the quadratus lumborum is involved in this kind of pathology, because also the spine needs to be free. So the supine position is the good position, and we can use easily the plate under the back. Okay. We can treat with a normal resistive electrode for prepare all the area and be sure that we can really affect the deepest layers of tissue. And then we can use all the tools, actually, the dia trigger, the dia small, also the dia blade large, because the chain of the iliopsoas muscle is going ahead over the let me show you, is going ahead also on the limb. on the lower limb, as you can see, as you can imagine. So we are going ahead with the pectineus and all the quadricep muscles. So when we're talking about hip problems, we not just need to focus on the hip muscles, but with the whole chain, and also with exercises, and also the automatic treatment, the hands-free treatment can help us a lot. For example, pushing the plate over here and the electrode on this part and doing some exercise, pro spingere verso l'alto, rilascia, like PNF, spingi su, ragazzi un po' di zoom, sorry, spingi su, rilascia, spingi su, e rilascia del tutto. And then relax, complete relax, have a complete relax. So it's very easy with this kind of deep pathology to achieve great results, because usually with our hands, well, it's not so easy. Before that I had the opportunity to have this kind of tools, I need to do really a lot of job with my hands, going deep on the iliacus crest. Okay, it's so also painful for the patient. It's not so easy because there is the intestine also, as we said just before. So not so easy to affect properly the treatment and the muscle. By the way, with this kind of technology, it's very easy to achieve results also with these difficult pathologies, because I think that you know, Nancy, that this is a not easy pathology to manage in the physiotherapy world, in the physiotherapy way. So I suggest you, I know that you have the machine already, so I suggest you to share your experience too. Maybe you got some ideas that we can share together with all over the physio that are following right now.
Yeah, other questions is about how to combine TECAR with a low or medium frequency current, like shockwave therapy, high intensity magnet, if we can combine these two therapies. If yes, which one should be the first?
Low, medium frequency current, okay. Shockwave, high intensity, I see here. Okay, see. Well, I got an idea that is my point of view. Like also Diego was talking something about this. That when you do a treatment, you need a time for see what happened before. You need a clear vision of the patient. So you need to manage not so many variables at the same time. So you can, of course, combine different therapies, different techniques, different currents, of course. You have to be sure of the effects of the different pathology, the different technologies, for example. But I suggest you to use once a time or to evaluate and re-evaluate your patient before each session. Of course, it's very easy to use shock waves and magnetotherapy and all other devices. We need to be, well, I say experts in all of them, because we are using high level of energies, I can say. So I remember when I was talking to Diego, that he also was combining for ischiotibialis pathology, chronic pathology, also the shock wave. Isn't Diego? Isn't you?
Yeah, it's true. Answer that question. I think it's possible to combine all of them. It's not a problem, but of course you have to make evaluation, think about what we want to do, what we want from this tissue. So if you do everything that is possible, we even cannot understand after what is really helping. So exactly. It's possible. You cannot will not have some reaction. Maybe just if you make a really heat treatment and then you make a shock wave, you can have a reaction because it's too much things altogether. But if you know that this is what that tissue needs in that moment, it's possible to do. About the hamstring insertion, proximal insertion, I have good results using combining TECAR fascia tools to decrease the tension in the tendon, in the muscle or hamstring. And then when we have a kind of tenioperiosteitis, this insertional in the tuberosity of the ischial tuberosity. We have pain not only in the muscle tendon but in the bone. In that case, especially in that case, after make fascia tools, TECAR treatment, manual stretching, I make one session or two sections of shockwave therapy, and then I give 1-2 days off and wait the results, and usually it's very good results. In the case that I have bone pain, not tendon, if I have in the tendon or in the muscle, or only for stiffness, I usually I do manual and TECAR therapy.
Good. All right. All right. I saw a question from Nancy. Yeah, okay. I don't know. Can you see, Diego, the same questions about a chronic? Okay.
No.
Nancy is asking to us about a chronic rupture of medial gastrocnemius with insertion retraction case.
Yeah, it's a big problem for athletes.
Yes, of course.
But okay, retraction, chronic, it means already a long time. So probably you have a big fibrosis in that position. So we can combine everything. Of course, it's too much painful. It means not so chronic phase. So you should give possibility. You should give more elasticity, resistance to that new scar tissue. So.
Yeah.
Deep treatment, I don't see why shockwave therapy in that case. I think is we can have already very good result with fibrolysis, with fascia tools, improve temperature, improve the metabolism in that position, make one treatment. Of course, if you are sure that we are already in chronic phase, because if you damage big lesion like this, if you go deep with fascia tools or improve temperature, you can have some hematome or some problem. But the question, as I understood, was about chronic phase, so with already retraction. So in that case, you can be a bit aggressive. So fascia tools, fibrolysis, stretching, eccentric exercise.
Exactly. Also, the exercise are very important, and also we can combine the hands-free during the exercise, during the eccentric exercises or reconditioning exercises.
Yes.
All right.
Important always evaluation, understand which phase we are, and then decide which treatment in that moment.
So here we go. We're going to conclude with the lower part of the limb. We're going to do some examples on the treatment of the plantar fasciitis, or it could be the gemellos. Just for understanding how to put the plate. Ok, facciamo sul basso. For example, if I need to treat the calf, for example, this could be a good placement for the plate, because here I get all the ability to manage the tooth, to manage the calf, to massage, to doing the traditional TECAR, or also to do the technique with the tools. Okay, as you know, the gastrocnemius junction is one of the most typical sites of lesion and of densification. Maybe I can show you here just in 1 second just what we are talking about, because always the anatomy help us to understand what we are talking about. So we are talking about calf. Okay, the point is exactly this one, where there is the ending on the calf. Here there is a musculotendineal junction where the tissue starts to become more connective. So as you can see here, there is some white color. So the type of tissue is different. And I don't know who of you uses ultrasound diagnostic imaging during his day-by-day practice, but it helps a lot also in that question of Nancy, for example, about the rupture, the chronic rupture. The ultrasound imaging, just putting the echograph here, you have a clear vision of what is going to happen under the calf, and you can also show to the patient before and after the treatment what's going to happen. So have a look that the fascia doesn't work, and you explain to the patient, and then you do the treatment with a fascia tool, for example, or whatever you want, and you can show again to the patient that the thing are changed. Okay, so it's very important thing. It's very important tools also for educate and also for, I can say, convince the patient about your job, of course. Okay, so
it's a question about the hamstring position of the plate for a hamstring pull injury.
Okay, so this could be right. Perfect. So this is an opposite geometry. We can easily reach the proximal insertion of the hamstring. We can easily do some exercise too. Porta verso gluteo il tallone. Okay, just imagine that I'm using. Okay, Lassa. Imagine that I'm using the tool, for example. So of course, if we are in the acute phase, maybe we are not going to use the tools directly on the lesion. But if I get the lesion here in the middle, in the third medial of the hamstring, I can have a more strong technique just above and a more strong technique just under. Okay. So for example, I just put an athermic treatment here. Okay, but for sure I could do a more aggressive treatment in this area or in the lower part, because I want to solve, I can say, the stiffness for relax this area. But in the early stages, I will start with the capacitive and maybe some resistive traditional mode, okay, like this one. Okay, and maybe in the third, fourth day after the lesion, I can use also the fascia tools. But about the positioning, this is the right positioning because we have a transversal geometry. The plate is under here, so it's very easy to set up the treatment. Also for the second phase of the treatment, we can use the exercises for the verso gluteo with the concentric phase, okay, and also with the eccentric phase. Porta verso gluteo, resisti. Ok. Di nuovo. Porta verso gluteo. So, and during these exercises, we can have also the therapy over the lesion side. It's very easy. Good. Yes, I was talking about the couch. So, maybe Diego can tell us how he treats the fasciitis, because, for example, for the fasciitis, we have several options that you can easily find on the site too. There are some courses, some video courses. Whoop. Because there is this possibility to use the dia blade small here and the plate over here. But what's the point is that the geometry between the plate and the electrode is very long. So we need a high power level. We can do, all right, maybe we will perceive some increasing in temperature of the ankle, but it's very, very good because we can combine manual techniques with fiber releases, all right, and we can put also in a stretch position the fascia, so it's very, very easy to treat. Or maybe we can use another position.
Yeah, usually I do like that. To short the geometry, and I can put more pressure when I use the trigger for fasciitis plantar treatment.
Yeah, that's right.
Yeah, exactly. This is the position. Usually I use the trigger.
Yeah, you use the trigger. I had some patient with heel spur. That is a different kind of pathology, as you know, is not the plantar fasciitis, but is more proximal to the calcaneus area. For reaching those deep tendons, I want to show you here because it's very interesting to understand what I'm talking about. I'm just going in a plantar view. I hope you can see here. So I'm talking about this area here, and if we remove the layers, the muscular layers, we have 3 more ligaments, okay? So this one, the long plantar ligament, and the short plantar ligament, maybe the short plantar ligament. So for be very precise on treating these ligaments here, I suggest to use the dia blade small, okay, that is very precise. We can really reach the deepness of the tissue and be very precise for that kind of treatment.
Very good. Maybe
Experience
both.
of the heel spur, some heel spur pain.
Yes, it's the same. We cannot remove the spore because it's already calcification, is already bone. But as the same like a shock wave, that in the beginning the people believe that shock wave can remove the spore, but with the practice we understand that it's not like that. We can just treat the inflammation, the inflammatory chronic process around, and several times there you have a very good result. So I use usually the same technique. I don't have a lot of cases, to be honest, as I have much more than fasciitis plantaris and Achilles tendinitis. So
okay.
Let me tell you something too. In the other position, laying on the back, laying on the front, it's very important, in my opinion, to treat always fascias and soleus, because these muscles, when you have a tendinitis, when you have a metatarsalgia, when you have a fasciitis plantaris, we always have this calf stiffness, and usually in the distal part of calf stiffness. So we cannot say that this stiffness is creating the tendinitis, the fasciitis, or the metatarsalgia, but for sure in that pathology we have this. I believe that is the origin of the pathology is the stiffness in that position, because this will change the biomechanics of the ankle, and we'll start to create some imbalance and some compensation that will put some tissues in overstress. Sometimes metatarsal head, sometimes fascia, and several times the insertion of the tendon, the Achilles tendon. So always when you have foot problems, mobility of the ankle, and even treating the calf, distal part of the calf, you can improve the dorsiflexion of the ankle. So when you do this, and we know for a treatment of all these pathologies said before, you have to improve the dorsiflexion of the ankle. So always start treatment. Even when I have to make some treatment for a fasciitis plantaris, I start in this position, hard and deep treatment for soleus, and then I this position for Achilles tendon, or change position for fasciitis plantaris, but always started in concentrated with focus in the calf, especially soleus.
Yeah, always I think we have to reason in a myofascial chains. So exactly like you said before, most of the time the plantar fasciitis is an overload of other districts that are not working properly. So really thank you for your experience, because I'm very glad to share this experience with you and with all the people from home. I hope we can increase our academy group. I think we are almost at the end of the session of the webinar. Mauro, would you like to say something?
It was a question about how to treat a frozen shoulder, but this is something that we will treat
on
next Thursday.
Yes, on Thursday. Thursday morning, don't miss at 10 o'clock in the morning. So, Mario, would you like to come here just for say hello to everyone? And for say really thank you to Diego.
Yes, we already finished for today. I would like first of all to thank you, all of you, to enjoy with us. I hope that was a good experience. I'm really sure that it was a good experience, because it was for me. I would like to thank you, Diego, for staying with us and for spending your time, and your experience with us was great.
It's a big pleasure, and with Enrico we have always something to learn. So I say thank you to you guys, Globus, thank you to Enrico and everybody. And I'm sure that the people enjoyed that, your fantastic presentation.
Thank you very much.
Very much.
I would like to thank as well Damiano, our model, and I would like to remind you that next Tuesday at 10 o'clock, as today, we're gonna talk about the upper part of the body, so frozen shoulder and other kinds of pathologies, always treated with fascia tool, but as well with our TECAR therapy. So see you next Tuesday. Don't miss it. It's going to be even more interesting. And bye-bye.
All right.
Thank you.
Ciao, guys.
Ciao, ciao. Ciao, guys.